Maayong adlaw. Welcome back to Pilipinx in Wellness. In our last episode, we spoke with Ana Salumbides about leveraging energy, healing, and intuition, the process of releasing old energy and connecting with our own intuition to hear ourselves again. Wow, what a powerful episode to listen to if you haven't yet. For our final episode of season two, we will be exploring integrative natural health with Dr. David Richard, founder, naturopathic doctor, and licensed acupuncturist. I'm Cheryl Samson Ramirez. My preferred pronouns are she, her, sha. I'm ethnically Bisayan and Chinese, currently streaming from the traditional territories and still living Chumash, Tongva, and Kich people, colonially known as Los Angeles. Philippine X in Wellness's vision is to support the wellness of the Philippine X community and our global allies through resource sharing, podcast streams, and partnerships with professionals and organizations in order to live healthier, happier, and more fulfilling lives. If you're not following us already, please feel free to follow us at Philippine X in Wellness with a P ending with an X in Wellness on Instagram, Facebook, YouTube, and on Twitter via the handle at PhilippineX, the letter N, the word well, followed by the letters N and S. We honor this safe space by asking everyone to speak and listen respectfully from your heart throughout our time together. This pre recorded session can be accessed through our Philippine X in Wellness YouTube channel, Apple Podcasts, and now also on Spotify. We're so thrilled to give our guests wider access globally. As always, we'll be sure to answer any questions that you have sent us via our Instagram stories within our episodes. Please keep in mind that anything that is discussed is for informational and educational purposes only. It is not meant to be medical advice. Always consult with your healthcare practitioner for your particular condition, especially before starting any exercise or new health program. Philippine X in Wellness was formed to provide a dialogue around topics that affect the wellness of our community. We're here to also highlight Philippine X individuals and organizations that are actively doing wellness work. Without further ado, I'd like to introduce our guest speaker, Dr. David Richard. Dr. David Richard is a California licensed naturopathic doctor and acupuncturist. He received his doctoral degree in naturopathic medicine and master's degree in acupuncture and oriental medicine from Bastyr University in Seattle, Washington, the nation's leading institution in research and education of science based natural medicine. Dr. Richard participated in a China externship at Shanghai University's Traditional Chinese Medicine Teaching Clinic, where he had additional training in internal medicine, gynecology, and the application of Chinese herbal medicine. Dr. Richard founded Integrative Natural Health Incorporated in Claremont, California in 2009. Dr. David Richard's mission is to educate individuals and communities on how to achieve optimal health and wellness in the most natural way possible. Through proper dietary habits, nutritional support, and an emphasis on preventative medicine, Dr. Richard believes everyone can achieve their health goals. He utilizes natural therapeutics, modern medical technology, and the knowledge of Western and Eastern medical philosophies to diagnose and formulate treatment plans specifically for the individual. He provides educational tools and lifestyle suggestions that empower individuals to take responsibility of their own health and well being. We would like to welcome to Philippine X in Wellness for the first time Dr. David Richard. Welcome to the podcast, Dr. Richard.
Hi, thanks for having me. I'm excited to be here.
And we're excited to listen to what you have to share with our community.
Great.
Now, something that we always start off with in our episodes is asking our guests, where is your family from in the Philippines and where are you currently streaming from, in case that's different from where you're residing?
So my family is from, it's my mom. She's from Cavite, specifically Nai Cavite, which is pretty close to Manila. So I'm half Filipino, and my father is from Canada, French Canadian. My last name is actually Richard, and he comes from Toronto. So yeah, we've been
Mhm.
in Southern California. I was born in LA. My practice is in Claremont, which is about 30 minutes inland from Los Angeles.
Right.
Yeah.
Cool. You know, when you say Toronto, there's also a big Pilipinx population there in Toronto. So I was happy
Oh
to,
wow.
yeah, I know that Brampton is a popular suburb where I have family in, and also there's a huge Filipinx population after like the South Asian population that resides there.
Well, I was there when I was 9 years old, and I got to go back
For
to
sure.
Toronto. Yeah.
Yeah, the T dot, or what they say. Now, let's start with the basics. For our listeners and viewers, our first podcast episode way back was on East Asian medicine, which included acupuncture. But what is naturopathic medicine, Dr. Richard?
So there's a technical definition, and then I could tell you a little bit more in layman's terms. But naturopathic medicine is a distinct primary healthcare profession, emphasizing prevention, treatment, and optimal health through the use of therapeutic methods and substances that encourage individuals' inherent self-healing process. The practice of naturopathic medicine includes modern and traditional, scientific, and empirical methods. So naturopathic doctors are also called NDs. Depending on what school you go to, there is a school in Arizona that designates their graduates as NMDs, or naturopathic medical doctors. And the curriculum is pretty similar to going to a medical school to become an MD or a DO, in that it's a 4 or 5 year program, and emphasizing natural therapeutics. But all of the curriculum goes through the basic sciences, the clinical sciences. Diagnoses are pretty much exactly the same as to how we come up with the diagnosis. But treatment is very different, of course. We always follow what we call a therapeutic order, where we're using the most gentle, non-invasive treatments like dietary changes, really observing and finding the obstacles that people need to get over to get their body to heal. And we move through a ladder where we may use some nutrients, we may use some herbs, and then if somebody's not getting to where they need to be, we use more pharmaceutical medications, and then the list goes on to more what we consider invasive treatments like surgery, chemo, and that sort of thing. So, we are primary healthcare providers, and many of our patients really like the fact that we don't jump to pharmaceuticals as first line therapy.
And that's pretty profound when you talk about how your emphasis is on preventative measures and actually allowing the body to heal themselves. Why is it that we don't hear too much about naturopathic doctors and we hear more about the traditional MD degree or, you know,
Hmm.
what's your take on that?
Yeah, such a good question. We know we live in a pretty capitalistic society, and the money really goes into funding pharmaceutical research, and that's the primary education that medical doctors get. And so that's often, where we'll see lots of ads and commercials, and where the money is often what we're going to see in our media. But we know that a lot of people don't get where they want to go. They don't get to the healing process, and so they seek other options. A lot of times they have to figure out, who's the professional that can help them, and if they're in a state that licenses naturopathic doctors, it's a lot easier to access. Um, there are other alternative practitioners, so there's lots of other options, but it's nice to know that you can go to a professional that is formally licensed in the state and has a degree that is backing their education. So yeah, that's where naturopathic doctors can really help kind of fill that void of people that really don't want to go all in on pharmaceutical medications for their treatments.
Yeah, you may often hear of acupuncturists as other practitioners, right? And
Hmm.
asides from our Western medical practice, but naturopathic doctors is not often heard of. So maybe our listeners or viewers for the first time might actually be hearing about this angle and didn't even know that it was available.
So
You
true.
mentioned that there were states that license naturopathic doctors, so not all states in the US license
That's
naturopathic?
that's correct. Yeah.
Okay, and what
There was
states are
a
those?
time.
Yeah.
So, I don't have the list in front of me, but there was a time when most states licensed the profession, and it was early in 1900s. Before pharmaceuticals really started to pick up,
Okay.
really just take over the whole medical system. So around 1900 to about the 20s, it was very popular, and then unfortunately, pharmaceuticals. Well, that's a good thing. There's a place for pharmaceutical medication, but it really just took over, and people abandoned naturopathic medicine up until recently. It's in the 70s. A lot of the schools started to come back on the scene, and some states, like the whole West Coast, is licensing naturopathic doctors, and they're scattered throughout. But I believe there's about half the states now, and a lot of the licensures are recent, with recent bills that were introduced. So it seems like there is a resurgence, and it's been going on now probably for maybe 50 years, but it's really starting to pick up again.
Now, do we only see naturopathic medicine being practiced in the US or is it practiced in other countries?
Right. So there is a school or maybe two schools in Canada. So Canada licenses the profession. I believe Australia and New Zealand as well. So there are practitioners that go to other countries that practice unlicensed. So, that usually means that they don't have like associations, insurances, like malpractice type of insurances. So it's a little different. They probably aren't doing their full scope of their training, because we are diagnosticians and we order labs, we order images, we refer to specialists. In other countries where they're not licensed, they're probably not doing it.
And is naturopathic medicine only used to address physical conditions? What about mental health?
So, it's holistic medicine. So it's definitely going to also address mental health. And there's a lot of therapeutics that we use. Um, and, if we're thinking about the therapeutic order, a lot of physical medicine is used for just getting people moving, getting their circulation going, really helps with kind of more mild type of mental health issues. But then there are certain herbs and specific nutrients that we use at what we consider like therapeutic doses, that do help influence mental health in many ways. So, yeah.
Cool. In your bio, you mentioned your educational pursuits that led to your career as a naturopathic doctor and licensed acupuncturist. Can you
Hmm.
tell us about your origin story? Growing up, many
Yeah.
of our parents, right, they asked us to be lawyers or doctors or
Right.
nurses, engineers, and but when we traditionally think of doctors, we're usually referring to Western medicine, or they are, right? And
Yes.
we talked about that because of the popularity of it. Now,
Sure.
how were you in particular introduced to naturopathic medicine, and what were your deciding factors in choosing to pursue this modality over a degree in
Hmm.
Western medicine?
Yeah, and it's true. I have lots of family members that were discouraging me, that really wanted me to go towards more of the medical degree, MD degree or DO degree. I was studying science. I got a biochemistry bachelor's degree. But even before then, when I was in junior high, I had a really good friend of mine who was Korean, and his father was an acupuncturist, and that was where I was first introduced to it. And he actually gave my brother some treatments because he had some back pain, and so I always knew it was a modality that was an option. But I never thought I was going to be an acupuncturist, even when I was pursuing the naturopathic degree, which happened, right after college. I still didn't think I was going to do acupuncture, but it was the more mainstream type of what we consider alternative medicine. So most people have heard of acupuncture or maybe even have tried it. But when I was in college, I was studying biochemistry. I was working in a lab. I worked as a pharmacy technician. So I was really on the more Western medicine side. But when I did a study abroad program for a year in Sweden, I started to, yeah, I was only 21. So I was still figuring out who I was, what I wanted to do. And I moved away from home and, started buying my own groceries. And I discovered that there were options, organic, and that's the first time I saw that because I wasn't doing my own groceries when I was a teenager. Now, I had to ask people, what is this? In Sweden, they called it ecologic. And then there was the standard that didn't have the ecologic. And of course, it was cheaper. So I was trying to budget, and
Right.
um, so yeah, some of the Swedes that I was living with, they said, yeah, this is meaning there's no chemicals. And so it really just started me thinking that, I've been exposed to so many chemicals, being in Western medicine, being in the lab, and, working at the pharmacy, really seeing the sources of chemical exposure was pretty widespread. And so that kind of got me thinking, okay, well, I want to be more clean, more natural. I think chemicals are important to learn about, but as far as putting it in my body, I was pretty healthy. I didn't feel like if I were to go to the doctor, I would want to take certain chemically based medications. So at the pharmacy, I also realized people were going in, they were pulling stuff off the shelf in the vitamin section, the herb section, bringing it up to the pharmacist. And the pharmacist was always saying, hey, yeah, it won't hurt, but not really giving any professional advice, and so I thought, hey, there's a a niche there that could be filled, and so when I was graduating at Cal State Fullerton with my biochemistry degree, there was a career day and there was a booth for naturopathic medicine, a school in Seattle, and so that also kind of got me thinking, oh, there's actually this professional, role that I could play and do all the things that I was thinking about. So I pursued it a little more, and there were some doctors in Orange County that I was able to visit, and they were really happy about their quality of life, what they were offering, and said, "Hey, this is a profession that could work, here in California." And it just got licensed, like right when I graduated, and
Wow.
so yeah, it was in California. It just got licensed, and it
Talk about
hadn't been.
timing.
Yeah, so it was good timing. Was While I was in school, it wasn't licensed for California as a profession, and so I was one of the first couple hundred practicing here in California.
That's a noteworthy thing to mention that you're one of the very first licensed naturopathic doctors.
Yeah, it's pretty exciting. So, but it's really slow. In California, it's really hard to get the scope expanded. Some of
Yes.
the other states that have been licensing for 20, 30 years, they've done a lot of work. And so, lobbyists and associations and all that really helps to get a profession really established and expanded. So that's still in the works.
Now, when you talk about Sweden and how you first discovered ecological foods, or what they called ecological foods,
Hmm.
I, I noticed that Sweden's also a country that practices universal healthcare. Do you
Hmm.
think that there is a correlation between universal healthcare and being able to provide these additional modalities when it comes to health?
Mm. You know, that's a really good question. And when I moved there just for a year, I was there. I didn't even know anything about Sweden. I was there really to study, and I kind of threw myself in there thinking, okay, well, the classes are in English. That really helps. But I learned so much about their political system, and they are considered like a social democratic state. And so I talked to a lot of people about what that means, and They had a lot of refugees there also, from like the Middle East, and they were working in lots of different shops or as drivers, and so I got perspectives from them as well, and just kind of expanded my just understanding of all of it. And but I was still really, really young and still learning about all of that, and so I didn't really make a lot of sense of it at the time until later. Yeah.
Yeah, I was wondering that because the other countries that you mentioned where they offer licensure in naturopathic medicine, you mentioned Canada, Australia,
Mm,
New Zealand. Those are all
mm,
countries also with universal health care. So I was also
mm,
wondering if there was a correlation there that
mm.
existed.
But I hear in Canada it's licensed, but it's not. It's you have to pay out of pocket. It's not covered by their national insurance. So yeah, I don't know if that's going to change or if maybe some parts are covered. Because in some of our states, like in Washington and Oregon and Arizona, even our Medicare is covering naturopathic doctor services. So I think it depends on the type of services. If you're doing primary care, you're doing physical exams, probably going to get it covered, but maybe certain therapies are not. I haven't really looked into it, but I know that a lot of it is out of pocket.
Yes. Well, got it. I think also, right, when that's one of the critiques too sometimes of universal health care is that there's more premium or there's more paid out of, well, it depends. I should correct myself and say it depends on the country.
Hmm.
Yeah. So in Canada, yeah, that's how they handle it.
Yeah. So, and when people are really wanting to make changes, I think they pay for it and they really try to get the most value out of it. Versus a insurance policy. Some like what we see. People go to their doctors and their doctors make suggestions, but they don't really. Not everybody takes it seriously, or they don't make the changes, or they don't pick up the prescription meds, and they don't really know how much the doctors are getting paid or how much it costs for a visit. It's there's a little disconnect there, I think. So when people come and they pay out of pocket, they usually stick to the plan, so they get better.
Right.
Yeah.
Well, that actually kind of leads to my next question, Dr. Richard, is you mentioned that you opened up your clinic, Integrative Natural Health, which our episode is named after.
Mhm.
In what year did you open it? And let's start with you said is was it in Claremont where it's located?
Yeah, so Claremont, in 2009, I opened it. I, I had some other doctors that were already working here that I was talking to, and they mentioned the coast is always the best because that's where all the money is. Again, out of pocket expenses, staying in, say, Santa Monica or Orange County is definitely going to be a better place for a cash practice. But Claremont is a pretty affluent community that I was told could support a practice like mine, and there wasn't another naturopathic doctor close to here. The closest at the time was in Pasadena or in Redlands. And so it's like 30 minutes each way. And location happened to be right next door to where my parents live in Pomona. So yeah, I took advantage of that. Lived at my parents' house when I moved back for a year and got my practice started. So 2009 to maybe 2012, it was really pretty rough just getting, trying to get the clientele built up.
Tell us more about that. How did you even roll out your practice or your clinic, being that the
Yeah,
climate back then, not everyone is really even knew what naturopathic medicine was.
right. Yeah, and so of course, you rent out or you lease a building and hope for people just to show up, and there were people in the community that did, but I wasn't in the village, like the downtown area. I was a little bit out, and so I had to really do some of the groundwork. I went to a lot of fairs. I did some talks. There were a couple churches that had events, so I would go and just talk with at a booth, or if they had an opportunity to go on stage and do a 15-minute spiel, I would take advantage of that. And so uh, there were actually there's a two churches called the Center for Spiritual Living here in Claremont and in, I think, Glendora or Covina area. And they're like a non-denominational church. So they have people from all cultures go there. And everybody seemed to be open to doing alternative medicine because I got a lot of people interested and eventually becoming my patients. So that was a good place to really just start to lay down some of the roots. And then from there, I did so much advertising that didn't pay off. I even had a commercial on TV, didn't see any returns. I had an ad on a TV at a gym, didn't see any returns. So it really ended up being just word of mouth. And to this day, we still don't advertise. It's just all, word of mouth and social media, actually. But I haven't really been active on social media. So, I think it's something that people are looking for. And so people come from all over, even the high desert. We have quite a few patients up in like Victorville that drive over an hour to get here. Um, so it's something that people really look for and travel to go to.
You mentioned earlier about when you first opened your practice that there were people that were recommending that you open it in areas in the coastal area where there was more affluence, or even in neighborhoods, right, where there was some money or affluence. I know that that's sometimes a thing, like within our culture, right?
Mm,
Like our parents or our aunties and uncles saying, "Oh, I don't want to buy that," or because it's too
mhm.
expensive, or not wanting to pursue different routes because of the price, yet they'll spend money on their brand name bags, for example,
Right.
right?
So true.
So, how do you create access when you
Yeah.
would definitely think that more of our community, or just people in general, should invest in more preventive or natural measures, and in this route or this modality? How do you create access when more of our community is just so used to falling back on what their insurance can provide?
Mm. Yeah. When I first started, my prices were much lower, about probably half of what I'm charging now. And of course, the financial environment is so different. 2009, we had a recession. And I started my business right in the middle of the recession. So I really had to make sure that I wasn't charging too much. And and that really helped because I had people, even students, that were coming and they were using our services. And so we got really busy. And I ended up adding another naturopathic doctor to my practice who specializes in seeing children because I don't see children. I was seeing some every once in a while, but when I added her, our practice like doubled because we had two doctors, and I was thinking, oh, she's going to take my business, but it didn't work out that way. In fact, more people wanted to come in, and so when that happened, we got super busy, and people they saved their money. They because we weren't like if for an example, if you go to a practice in Santa Monica for a first visit, you'll probably end up spending $500 or more, and just for the visit.
Wow,
Um,
yeah.
yeah, and then I was charging at the time about 180 bucks for the first visit, which is an hour and a half. So we really spend a lot of time. Um, and once we got fully booked up and our schedules were really hard to manage, we had to increase our prices. And so that's just kind of like business 101, right? And so we
Right.
increase our price, and so over now we've been here for 14 years. We've increased our prices maybe 3 or 4 times throughout, and every time we do, our business still remains very busy. So I think we're still doing all right, and we're not charging over $500 a visit. We're still, I have now a couple colleagues in the area, and so we're trying to make sure that we're not um, too different in what we're charging. So, especially being inland, we know that in an area where there's a lot of people that could use our services. So we're trying to keep it in a reasonable price range. So
So
we still find that we mhm.
go ahead.
So we still find that we have a lot of people that really just try to save the money for the first initial visit and a couple of visits to really make the whole experience worthwhile.
Do the number of visits also vary? Do you, because I imagine that you also create, being that you're focusing on the body's natural ability to heal itself, you
Hmm.
the number of visits might be less than going to a Western medical doctor where you might be more dependent on the medication or the level of care.
That's true. Yeah, we actually say if they don't come back, then hey, we must have got them healed or got their body to heal themselves. So hey, that's all right. But yeah, we do a lot of primary care. So there are patients that need to come in more frequently, depending
Right.
on where they're at. Like for example, if they have high blood sugar, high cholesterol, they'll need to come in every 3 months to make sure that we're monitoring, regularly because that's the standard of care. Um, but yeah, we teach them a lot, and we hope that when they get sick, they already know, what they can do because they've had that visit already. Like a cold or upper respiratory infection, we've seen lots of patients where they have an acute visit and we set them up with a plan, and if they ever get sick again they pull that plan out, and they get all the different tools, supplements, whatever we gave them, and they get it going. So that means they probably wouldn't need another visit unless things are different or getting worse.
Okay. You mentioned your initial assessment and having to go through that. So, if someone were to be a new patient, walk into your clinic, what would they expect? So there's the initial assessment,
Hmm.
and then where would you go from there? What services would you offer them, depending on what you're finding?
Yeah. So initial assessment is really big. It's really about gathering all the information, and that's why we take an hour and a half to really get a thorough history, but also look at all of their previous lab reports from all their doctors or specialists. And sometimes they have a binder, as people have a long medical history. So we really want to get a thorough understanding of everything. And we do a physical exam. We often order more blood tests. Being that we are naturopathic doctors, we're trying to also test holistically as well. So sometimes we'll do stool tests or saliva tests or urine and blood, sometimes a combination of all of them. So hour and a half is just enough time to get all of that. And then a lot of times we'll just put together a more of a foundational plan on that visit where we make sure that they know what it means to eat protein with every meal, to sleep, and what it means to have good sleep. And, just the basic foundational plan can get them started in making little tweaks to their lifestyle. But the second visit is where we're going to get more of the results from what we tested in the first visit. And from there, we interpret everything and we build on the plan where we start to be more specific, where they might need to take certain supplements or certain herbs, depending on what those results said and what symptoms they have. Um, and they might even include acupuncture. Say they're dealing with, back pain, neck pain, a lot of stress, digestive issues. We can definitely build an acupuncture plan where they come in sometimes every week. Um, some patients, like if it's, say, cancer, we have certain protocols where we use IV nutrient therapy, and patients will come in weekly to get an IV of high dose vitamin C. Glutathione is another one. Um, so, it all depends on what we're dealing with. And being that we're general practitioners, we see everything and every condition. And there's always something that we can do, something, even if it's not going to cure them, it's something that'll help support their body to hopefully start getting down towards that path. of either cure or managing whatever they're needing to manage better.
In what instances would you refer out or work with addition, I guess additional practitioners within their whole healthcare
Mm,
plan?
yeah. So cancer for sure, because I'm so limited into, I can't do biopsies. I know that some patients need higher intervention treatments like chemotherapy, radiation. So there are some, cases where we are the ones that diagnose the cancer. Maybe we do a blood panel and we see they might have some blood cancer going on, but they didn't know. And so, referring them to get all of the proper tests and also being offered the standard of, medical treatment, so we can either have them decide, do a combination of naturopathic medicine, conventional medicine, or if they're going to do all conventional medicine, maybe there are still some things that we could do to help, say, reduce side or make sure that, they're not harming their healthy cells. There are lots of kind of approaches we could take with that. So cancer for sure, we would want to refer out to get an oncologist on board. Um, Cardiovascular health often will need more sophisticated testing like the stress test and the EKGs. It's all good information to have when it comes to diagnosis. But when it comes to treatment, patients will want to decide, do I want to go with more conventional, more natural combinations? Are there alternatives to certain medications? Are there interactions? So that's really where we can help figure that part out.
Okay, so they don't have to exist separately. You can
No.
definitely, use naturopathic medicine to coincide
Hmm.
with the conventional medicine that a patient is also undergoing.
Yes, yes. And, there are some people that have different philosophies, and some people will say, I don't want anything to do with Western medicine. Okay, well, let's see if we can try to make some changes. And, if we can help you with only naturopathic medicine, let's give it a try. But I also make sure that I kind of plant the seed like, hey, if, a few months, if things aren't changing, I think we need to consider something else. So that way they get a little bit of that kind of, just plant that seed and see, if it's something that they are going to consider, they have that as an option. Yeah. I don't like to be like, okay, black and white. I want to make sure people stay open. Yeah.
Right. Well, I think we're at a great first half of talking with you, Dr. Richard. It's been really a great experience just learning more about preventative medicine.
Hmm.
I'd like to thank you all for joining us for our final episode of season 2. We're talking with naturopathic doctor and licensed acupuncturist, Dr. David Richard. Feel free to take a quick stretch, refill your water or tea. We'll be right back after this quick break. Welcome back to Pilipinx in Wellness. You were just listening to the first part of At First Glance by Ruin Pears off of their EP No Place, released in 2017. You can help support Ruined Pears by following them on Facebook or on Instagram at Ruined Pears. And that's Pears, Pairs. Ruin Pairs consists of Silent John, producer, audio engineer, DJ, and member of the Boom Bap Kids, and Jean Bautista, musician for Beat Ventriloquists, Wear Patterns, Nuka Luka, 1 2, and Josh 1. You can find our music on Amazon, Pandora, Spotify, YouTube, Apple Music, iHeart, Deezer, and SoundCloud. Shout out to our Pilipinx musicians out there laying down the tracks. Returning from our break, we've been talking with Dr. David Richard about integrative natural health. Dr. Richard, we spent the first half talking about your personal journey, your origin story, and some of the modalities that you offer at your clinic. As we were preparing for this episode, we talked about exploring naturopathic medicine's approach to testing and treatment of cardiovascular risk factors, since heart disease is prevalent in our community. Let's explore that now. What are some of the ways that your clinic addresses cardiovascular risk factors such as heart disease?
Mm, yeah. So, we really look at cardiovascular health as far as risk factors. There are many, and often involve multiple systems. So, not just the heart, but could involve the hormonal system with blood sugar control, in the immune system when there's a lot of inflammation. Um, and so, I often will want to look at a good panel of blood testing, as well as looking at their overall health as far as weight, lifestyle choices, diet. Um, but when it comes to heart disease testing, I think naturopathic doctors really do shine in this area because, when you go to, say, a cardiologist, they'll often hook you up to a bunch of machines, maybe a treadmill, get some data on when you're at rest, when you're say running or doing various activities, and that's really good information because that's stuff that I really don't have access to in my office. But when it comes to blood testing, often they only check maybe cholesterol, and cholesterol, is a model that's been around for a long time. It's been around for many years, and it's actually kind of dated. And there's a lot more that we could be doing and testing to figure out overall risk of heart disease. And so I always want to look at not just cholesterol, but we call an advanced lipid panel, where they're looking at the standard cholesterol panel, but then they also look at the good cholesterol and bad cholesterol, or what we call HDLs for the good, LDLs for the bad, and look at different sizes because they know that larger LDLs, which are the bad, are actually harmless, but the small, dense ones are the most risky. And the oxidized LDLs are the ones that make up the plaque in the arteries and are very risky. And so we could actually test those and see, yeah, your LDL is high, but are they mostly large or are they mostly in this risky, small, dense form? Um, so that's just an example of what we could call a advanced lipid panel. But then also looking at inflammation markers, because when you have inflammation, usually it's supposed to go up and then go down. Say you get sick, your inflammation spikes, and then you get better, it goes down. Or you sprain your ankle, it gets red, swollen, inflamed, and then it heals and goes down. But there are some people that walk around with lots of inflammation all the time, and that damages the arteries. And when that happens, that's when the plaque starts to get in, starts to build up, and now you're looking at clogged arteries. So, inflammation markers, there's quite a few of them, but CRP is a pretty typical one that medical doctors use for rheumatology to see if you have an autoimmune disease and they could track it. But we know that inflammation is also involved in heart disease, so I like to look at that. There's also specific markers for inflammation of the arteries, and one of them is called LPPLA2. Um, that one is pretty new test, but it will tell me if your arteries and the plaque are unstable, because that usually means if it's unstable, you might actually throw a clot, and that could a stroke or a heart attack. So testing the inflammation markers are really important, and I really want to make sure that when I see it, that we try to figure out where it's coming from. So some people have food sensitivities. You may have heard of gluten sensitivities, dairy sensitivities. Yeah, and
I'm both.
yeah, well, there's a lot of them, and they could even be foods you think of are healthy, almonds, nuts, seeds. If you're reacting to them, they're not so healthy for you, and that could lead to chronic inflammation. And so, looking for those sources. Some people have underlying infections. They might have an overgrowth of yeast or bacteria in their digestive system, and they're always dealing with digestive symptoms like bloating or diarrhea. And that could be something that could be treated, and also a source of inflammation. So really trying to figure out where inflammation comes from and then treating it, and hopefully getting all of those markers to go back to normal, can really help overall in somebody's treatment in cardiovascular disease. So, but yeah, diet plays a big role. It is something that, unfortunately, Filipinos are, people that tend to have a lot of cardiovascular disease, a lot of diabetes. So when we look at typical diet, we do see a lot of animal products, and animal products in general aren't bad, but when you only have a certain type where there's, I don't know if you've heard of omega-3, omega-6s,
Hmm.
these are fats that are in animal products. So omega-3s tend to be in more of the fish, when omega-6s are in the beef, chicken, pork, most land animals, and they're inflammatory. And so it's really more about the ratio. When you have more of the omega-3s, you tend to have a ratio that skews towards anti-inflammatory. And so when we talk about like the Filipino diet, yeah, there's fish in there, but it's, pretty fried or soaked in other oils that might be omega-6s. But there's also a lot of omega-6 sources like pork, and that could definitely outweigh the amount of omega-3s. So yeah, now you're in more of a pro-inflammatory state or susceptibility. Um, so yeah, there's definitely dietary changes when it comes to that sort of omega-3, omega-6, but also the amount of rice tends to be quite a bit, even compared to other Asian countries. You mentioned I went to China, to Shanghai. When I ate there, I thought it was going to be more like Filipino cuisine, where you have a lot of rice on the plate. But what I noticed is they eat rice at the end of the meal. So they have lots of vegetables. There's a little bit of meat mixed into it. But at the very end of the meal, they ask for rice to kind of top them off, to get them a little more satisfied. And it's not even that much. So I was thinking, wow, yeah, I was thinking it was going to be completely different, because we're used to even going to the Chinese foods restaurants here. You get a big mound of rice, and then they throw everything on top of it. Um,
Yeah.
so yeah, so I think that that could play a big role in blood sugar control, is the amount of white rice that's eaten, especially with Filipino cuisine.
Well, when you talk about inflammation, I do want to talk about food, but I want to come back to inflammation. When you talk about inflammation, I automatically think about gut health. But
Mm,
is it beyond inflammation of the gut? Are there other
mm.
organs in the body that can become
Yeah,
inflamed and contribute to, yeah, these health conditions that we're seeing?
well, autoimmune diseases can play a big role. If somebody has rheumatoid arthritis or lupus, um, psoriatic arthritis, these conditions, unfortunately, their immune system is in that state where it's always inflamed. And the markers that I mentioned are what rheumatologists use to follow if their treatments are working or not. So when somebody has an autoimmune disease, they also are contributing to heart health and heart disease risk, unfortunately. And so a lot of these patients, and it's really common, they end up getting put on steroid medications or more higher intervention to get their inflammation under control. So a lot of patients that come here, yeah, we try to figure out, how to get their inflammation under control, but we kind of take it in a different approach. Instead of using steroids, we'll look at gut health, because that often is where an autoimmune disease can start, where if you have a lot of inflammation there, it causes, I don't know if you've heard of leaky gut. Um,
Yes.
yeah, so the inflammation of the digestive system can cause you to absorb more than you normally would absorb because everything is inflamed. And that gets your immune system triggered. And so, yeah, you start to have uncontrolled inflammation. And so that's usually when we have a patient coming in with an autoimmune disease, where we start is looking at their gut health. So it's a big part of it. But, some people have good gut health, but they still have an autoimmune disease. And that's going to be hard on their whole cardiovascular system.
Got it. Let's go back and further deconstruct this Filipino diet from a naturopathic lens. I'm curious to I can you already imagine some of our listeners and viewers being like, what do you mean I have to cut out the lechon kawali or the or the like dilis that I like to eat with my vinegar, and like
Right.
what is rice other than white rice, and I
Right.
mean, and just thinking too though, with our culture, rice also was such a big part of the plate, or the diet, I think, from what I see, because it also was related to our country being a third world country, right?
Yeah.
And some of the fastest ways that you can satisfy your hunger is with rice. And I'm
Yeah.
not sure if that's why we've placed so much emphasis on the amount of rice, but oftentimes you hear family members saying that's the fastest way to get full, is to just
Yeah.
fill your bellies with rice, especially when you go through, the history of war, and food isn't always something that's easily come by.
That's true.
But how do we further deconstruct this from
mm
a naturopathic lens,
mm
knowing that we have diabetes, gout,
mm
these
Yeah.
cardiovascular and now cancer that we're seeing in our communities?
mm
How would you tell, like, your cousin, or
mm
people, your family members, how they can eat differently? Because I've also seen a rise of vegan,
mm
Philippine cuisine,
mm
um, and people that just only eat are pescatarian diets.
mm
So where would you go? How would you even start with a relative that needs to address
mm
these types of health conditions, but they're
Right.
so used to like eating the pandesal, or or the ensamada, or like
mm
the halo halo and the lechon kawali? Like
Yeah.
where would you go?
Oh, I'm telling you, this is a battle. Like with my own family, it's hard, and I I always try to emphasize blood sugar control because that's usually what is the problem. We often will see pre-diabetes really young in, a lot of people in their 30s. And by the time they're in their 40s, they might have full-blown diabetes. And so, blood sugar control, I think, could definitely be prevented if you make the changes early on. Um, and it often is the rice, and that's the last thing that Filipinos want to
Give up.
change, unfortunately. Yeah.
Yeah, but the white rice tastes so good.
It, and so, I also try to replace, because you can't just say stop something. Then there's going to be a calorie void, of course. Um,
Right.
and so, having foods that are more that add to the satisfaction, the feeling full, often would be more fibrous foods. And so, adding in more vegetables and healthier oils with that, olive oil or avocado oil, because there's going to be more of the calories there to replace that, void that you get when you reduce the rice. And I usually tell people that an easy guideline would be to start with counting 5 to 10 bites of rice. That's your limit for your meal. And most people, they could do that because they're not having to think about calories or how much it weighs, because when you use some of the apps that track your diet, you often have to put in, a cup of rice or this, measurement that they might not be doing. So a 5 bite rule, pretty easy. Most people can do that. And so
Right.
I say, okay, 5 bites of rice, the rest of your plate, focus on vegetables and a good protein source. If it's lean, it's even better. So that would mean like chicken breast, or if it's going to be beef, then it should be more of the lean cuts. Filet mignon, it's more expensive, but it is definitely leaner than a ribeye. You know, um, but yeah, trying to shift things over to focusing on protein and veggies versus the rice can make a huge difference. And if they also have high cholesterol, okay, now we got to think about, the saturated fat that could be coming from, more of the animal, like I was telling you, omega 6s, and trying to get things that are more lean would be best. So I find that people can do that, at least to get them started. And then if they see their labs changing, then it could motivate them to keep it going. So the 5 by rule, I think, it comes a long way.
I like that 5 to 10 bites. It just gets harder when you eat out, right?
Yeah,
It's Filipinos love their Chinese food when they eat out, especially for special occasions.
yeah, it's true. So, it's try to eat like they do in Shanghai, where they have the rice at the end. Yeah, but it's hard when you eat out. You have to expect that you're going to eat a lot more calories than you probably should,
Hmm.
and so you're probably going to eat a lot of other things too that you probably wouldn't eat at home. So yeah,
I mean,
got to eat out
I
less.
have friends that are probably going to hear this and being like, "No, I cannot give up the Wonderlist ice cream. I can't give up like
So
the
I
Magnolia."
also so I also make sure that they have those things. Just leave it as a treat, once a week, or have a cheat meal. That way they can
Right.
have something that they really love that probably isn't good to have every day. so it
Yeah.
keeps them in the game. And I think some people are all or nothing, but most people would like to have their treat, every once in a while. And so it's kind of a reward if they could do really good during the week. So
Yeah.
yeah.
Um, I was curious if you have any vegetables like in like Philippine vegetables that you like push in the diet, or any herbs that are from the Philippines that wouldn't be so much of a stretch, because sometimes when we're making adjustments right to diet, it's harder when it's outside of what you're used to purchasing in the market. So if
Yeah, it
someone were
is.
to go into like a seafood city and they're dealing with
Yeah.
these types of medical conditions, are there certain vegetables or like herbs that you would say is easier to introduce
Mm.
into their diet?
Well, for sure, the cabbage family foods like gailan. That's something that Chinese broccoli you can find in Filipino restaurants, Thai restaurants, it's everywhere. Um, Bitter melon, that is definitely a specific food that is more in Filipino cuisine. Um, it's bitter though, so not everybody really likes it, but it is one that helps with diabetes and lowers blood sugar. And you can find it in supplement forms, but also can get it into your diet. Ginger, another really good medicinal herb that is anti-inflammatory, very good for the digestive system. So it can be, a staple in the Filipino diet, and I see it in a lot of cuisines. And you can do more of it. There's always room for more ginger. Garlic and onions, also very important for the blood pressure, heart disease, immune system, anti-inflammatory, antimicrobial. So lots of good properties with even just those, spices. But you could do a lot with those. Um, but the cabbage family, there's a lot of medicinal properties. It helps support the liver detoxification, but also lots of fiber. And most people like those foods, right? I think most people can eat cabbage or eat broccoli, maybe not Brussels sprouts. I think it's a little bit too potent for some palates, but uh,
Yeah.
yeah, most of the cabbage family is doable. I think a lot of people can eat those, and even if you just steam it, it it's edible, right? So
Right. And
yeah,
substitutes for white rice or, rice
yeah.
pancit noodles.
Right. So there are lots of alternatives now, especially here in the U.S. and in California. There's quinoa. You could definitely go with brown rice or wild rice. There's going to be more fiber, and that's what it is. They strip the fiber, and then that's how they come up with white rice. Um, so if you got the more whole food version, you're going to have more fiber there, and it's going to also slow the absorption of sugar into your bloodstream, so you don't get that big spike. And that's also important to know that you have to have a combination of those macronutrients. Like you have to have protein, you have to have some fat when you're eating the rice, because it's otherwise it will spike your blood sugar, and the other foods tend to slow the absorption. So when you're snacking or having some desserts, it's good to make sure that you have it with those other foods and not just by itself.
So for our vegans and vegetarians, what types of
Yeah.
proteins would you recommend to help balance their diet?
Yeah, so proteins are so important, and that's usually where people fall short. There's a lot of vegans that are not thriving because of that reason, is they're not getting enough protein. So there's a lot of soy products out there, but there's also a lot of GMO soy. So having organic soy products are going to be the better choice. I know there's a lot of guys that are wanting to stay away from it because of the estrogen properties, but soy phytoestrogen is really not a strong estrogen. And they find that you really have to eat a lot of it to really have any estrogenic effect. So I think if you're a vegan or vegetarian, that's probably going to be the main source of protein is soy products. Nuts and seeds, beans also have, but some people can end up with a lot of starch, and if they're eating beans mostly, nuts and seeds, they're good, but they're also high in calories. So, people are trying to lose weight, or, you really have to make sure that you can't eat a whole thing of, say, peanuts, because that's going to be like 3,000 calories right there. Um,
Yeah.
yeah, and then there's a lot of protein sources in supplement form. There are protein powders that are fairly good. A lot of people are doing collagen, because collagen also has the benefit of helping your joints, your skin, your hair, nails. So that is a protein source, but it's not vegan. So, some people will definitely not want that. Um,
Yeah.
but a lot of the other ones that are vegan protein powders are usually from pea or brown rice combination. So, that's an option. I think it's better than not eating any protein. Uh, it's something that'll at least help you get a certain amount.
Got it. I was gonna maybe we could touch on this briefly because I also wanted to talk to you, Dr. Richard, about cancer. We're
Yeah.
seeing an increase in cancer. I mean, among our age group, surprisingly.
Yeah.
So you started to talk about this when you were talking about your treatment. You mentioned you do a higher dosage of vitamin C.
Hmm.
I was curious about that because is there also a dosage that's an unhealthy dose of vitamin
Mm.
C when it's too high? And then
Right.
you mentioned another type of treatment. So what is your approach to cancer
Mm.
at your clinic?
Yeah. So definitely want to make sure that they know where they're at with it. If it's what stage it is. Um, Also, what treatments they're on, because some of them can have a lot of side effects, and we do have a lot of um, treatments that can help with preventing of side effects from chemotherapy. Um, but as far as what we offer for treatments, protecting nerves, definitely if they're on chemotherapy, is a big part of it. But high dose vitamin C at a high dose does act like chemotherapy. Um, so, just to give you an example, when we take vitamin C as a supplement orally, we take about 1,000 milligrams, and that's enough to get absorbed. In fact, that's about as much as we can absorb. But then when we have it in an IV, we can go up to 100 grams or 100,000 milligrams in a bag that drips over a couple of hours. And so that's a big difference. And when it's at that high dose, usually if it's above 25 grams or 25,000 milligrams, it actually has an oxidative effect versus an antioxidative effect. And so oxidative effect is what chemo does. And so it can actually kill tumor cells at a high dose. And so, I have some patients, I actually have one that had stage 4 breast cancer, and she does high dose vitamin C every week, as well as a lot of other treatments. And she's also on a vegan keto diet, takes a lot of supplements. She's cancer free. She's had 3 PET scans that show no activity. So, that's a patient that responded really well to
Wow.
a lot of different treatments. And she didn't do chemo. She did some hormone therapy, for blocking some of the receptors, but
Hmm.
that's definitely an example of somebody that did everything as
Yeah.
far as naturopathic medicine is concerned and got a really good response. So,
Right.
I
That's
mean,
pretty
that's what we hope everybody.
incredible.
Yeah, it is. And so she's really grateful, that she has all of these options. And, she tries to get a lot of it covered, through her insurance, but she does
Uh-huh.
have a lot of out-of-pocket expense too. Yeah.
Yeah.
So, a lot of the alternative therapies, unfortunately, you'll have to try to figure out how to pay for it. And yeah, so, sometimes Medicare will pay is if you can find out how to bill. Yeah.
Uh-huh. How do you interface with, I know we were talking about pharmaceuticals in our first half. How do you interface with patients that are using pharmaceutical medication, psychotropic medicines, if they have mental health conditions, or
Yeah.
how do you assess when you're administering herbs, right? What the contraindications are, or even to know what they can tolerate?
Hmm. Yeah, that's a tricky one. Usually if somebody has a diagnosis of a mental health condition and they're on medication and they're stable, that's a really good sign that the medication is working. And we don't usually want to really mess with it. There could be other symptoms that they're experiencing that need addressing. So that's kind of where we would go first. And if they express that they want to get off the medication, then we really have to figure out, what the best approach is. And a lot of times it means they need to wean off of what they're on. And while they're doing that, we try to support neurotransmitter health. And so there are lots of nutrients, also herbs that support, say, serotonin, dopamine, while they're getting off their medications. Hopefully they'll have a smooth transition. But a lot of patients have struggles with that, and I just tell them like that, this medication, if they were stable, was working for you, so you can always go back to it. Um, so a lot of there's definitely a struggle there though, and then there are people that want more tools, because they use, say, an as needed anti-anxiety medication, and they might be able to use something else that could work but not have that addictive quality, and maybe use that anti-anxiety medication on the back burner if, say, the anxiety ramps up to a panic attack. Okay, we've got a tool for that. So there's kind of like a gradient of treatments that we try to use that aren't as harmful. If that makes sense.
Yeah, got it.
Yeah.
Now let's
So,
go ahead. we
well, I was going to say, I see a lot of, especially during the pandemic, I saw a lot of
Yeah.
patients for anxiety and stress, and a lot of teachers, a lot of healthcare
Oh,
workers,
for
and
sure.
Yeah, so we use a lot of our tools. A lot of them ended up doing acupuncture, um, really using a lot of the herbs that tend to be more calming, addressing
Mm,
things like cortisol excess,
mm.
and so there's a place for naturopathic medicine when it comes to really, addressing mental health without using too much medication, because too much could be, very sedative, really, and kind of shut things down.
Yeah, we're also seeing the increase of anxiety and depression among young children too, right?
Yeah.
And youth. So I'm sure when you're administering herbs, you're also adjusting the dosages,
Yeah. So we
accordingly.
know, which herbs will affect certain, say, neurotransmitters, or if it affects the liver, then, certain medications might not work the same. So we have to check
Yeah.
all of that. Yeah. And adjust things as, we go along. Yeah. And there's lots of courses, I have to take continuing ed every year, and we are required to do pharmaceutical hours as well. So we really try to know, the what medications people are on and what they interact with.
That's cool. Keep
Yeah,
keep the knowledge current for sure.
exactly.
And for members of our community that are interested in your clinic services, we talked about your intake process, and you also mentioned cash payment. Do you accept any insurance?
So there are people that have PPO insurances that will cover the labs. So we use Quest Diagnostics, LabCorp, and the PPO insurances usually cover all the labs. They don't cover our consultations. Um, but I also have some patients that have something called a HSA, or health savings account, through their job,
Yeah. Mm-hmm.
where they can use that here for the consultations. But
Okay.
most of the time it's out of pocket, and we could give a super bill with all the coding. And
Right.
some patients get some reimbursement, some don't. It all depends on their plan.
Right. And then being that we have a global audience, let's talk about other naturopathic practitioners or licensed puncturists that you'd like to shout out or recommend in other areas.
You know, I was trying to come up with a list. I came short.
It's okay.
so so yeah, I don't have any right now.
Well,
But
if they
I'll
come up,
email you some. Yeah, if I
okay.
come up with some, I yeah,
And
not
we'll
today
share
though.
them on our platforms, especially for our folks listening in Seattle. I just saw our recent diagnostics, and we do have listeners that are listening throughout the globe. So
Oh, okay.
definitely we can plug those practitioners if you have any to recommend. And
Yeah, and if you have it on the YouTube in the comment section, would I be able to drop any of the names down
yeah,
there? Or
we
yeah,
could total. If not, if it, I'm not sure if it's deactivated, but if not, I'll make sure to find a way to include them for sure.
yeah, cool.
And before we close, we always like to ask our guests, what are your own wellness practices? So clearly, you're a naturopathic doctor, a licensed acupuncturist. You must have a full, almost clientele caseload. So, what do you do for self care that might be inspirational for
Yeah.
other
Well,
individuals that are listening?
I really am an outdoors person. I love to go out and connect with nature. So hiking has been my passion for over a decade. Um, I don't know if everybody knows where Mount Whitney is, but it's the highest point here in the lower 48 in the US.
Uh
And I've
huh.
climbed it every year for 12 years. So that's, yeah,
How many
always training.
miles or like kilometers is that for our folks on the metric system? How many
Yeah.
miles? Yeah.
Well, there are multiple routes, but the main route is 22 miles round trip, and it goes up to 14,500 feet. So
Wow.
the oxygen is very low, the air is very thin. I usually like to do an overnight, or 2 nights, so I can, really experience everything and not always have to just keep going and going. So yeah, hiking has been my passion. Mountain biking. Recently, I've been really serious on weight training. I think muscle tone, muscle mass is very important as we age, because we do tend to lose that. and I'm in my 40s now, so I want to make sure that it's like insurance that I get my muscle mass on for my 50s and 60s and whatever.
Right.
So yeah, so that's a big
Protect your
part of my.
bones.
It protects your bones, your joints, even your
Yeah.
immune system. There were studies that showed people that had more muscle mass and they got COVID, they didn't do as bad. So
Oh,
people, yeah, and even with diabetes, because muscles are like a sponge for sugar. We store sugar in our muscles, so it can be really helpful for people that have, blood sugar issues. So,
yeah.
so yeah, I've been focused on that. I just finished a 6 month, pretty intensive weight training program. So I'm taking a break
Yeah.
right now for a week. But yeah, so I'm pretty active, and I also take a lot of supplements, and also working on mobility. I do Pilates every week, yoga,
Cool.
stretching.
Yeah.
So yeah, it really takes the full thing, not just like cardio or just weight training. You should be stretching and doing all of it.
Yeah, I was
Yeah,
just thinking about that this week. I was like, I need yoga back in my life.
yeah. Well, consider that.
I know. And so for those of you that are obsessed with your Peloton bikes, you can add some more weight training to that.
Do it. Yes, it'll pay off. And too much cardio could be a bad thing. You start burning your muscle mass. So,
Yeah, so just like balancing your plate, you got to balance your exercise.
exactly. Yeah. Moderation.
So as we begin to close, how can our listeners find you if they have additional questions?
So, Integrative Natural Health in Claremont, you could do a search. My website is integrativnathealth.com. And I also have a store for supplements called storeinh.com. And there's a promo code Pilipinx for 10% off.
Yep.
And it'll always be open. So anybody, even a year from now, they want to use Pilipinx, they can get on my website. So
Thank you. We
yeah,
appreciate that.
of course.
Thank you, Dr. Richard, for talking to our community about integrative natural health. We're so honored to have featured you on our podcast for our community to learn about the preventative approach through naturopathic medicine and acupuncture. We are excited to witness how your journey continues to unfold and are here to support you as your Philippine X and Wellness family.
All right, my pleasure.
And to our listeners, look out for our next episode. We will be featuring Ness Marco Morales, a registered dental hygienist and capoeirista, founder of Capoeira Batuque, Daly City. This will be our first episode of season 3 and will be aired on Wellness Wednesdays on April 12th. As we close, we'd like to say thank you to our guest speaker, Dr. David Richard, our social media strategist, Kathleen Torrio, our designer, Ritchie, Ruin Pairs for consent to use your track at first glance that you heard during our break. Our advisors, Alison Taylor Cruz, Rian De Los Reyes, and Safo Tialogo. Our community partners is Filipino American Life, SoCal Filipinos, and Trek Table, and all of our community members for your shares and support. As always, we'll share more about our guest speakers' offerings on our Instagram stories and highlights for permanent access with any of our upcoming events. Be sure to follow us at Philippine X and Wellness on Instagram, Facebook, Apple Podcasts, and Spotify, and on Twitter at Philippine X, the letter N, well, followed by the letters N and S. Don't forget to continue to hit the subscribe button on our Philippine X and Wellness YouTube channel. Thank you always for believing in us. Be well, everyone. Continue to take care of yourselves and each other. Daghang salamat.
Salamat.